Hello everyone. So in this session we will be discussing about the next content of the chapter MTP. MTP in sense medical termination of pregnancy. MTP in sense medical termination of pregnancy. So what is medical termination of pregnancy? In short we can call it as abortion. So these abortions, or why they have to do, what is the necessity of doing the MTPs? So for what purpose the doctors suggest for the MTP, we'll see one by one. Let me tell you the definition of MTP first. The definition, it includes the voluntary, intentional termination of pregnancy of full term. Full term is known as MTP. So, in what conditions the doctor suggests for MTP or abortion? So, we will see that it was first legalized in India in the year of 1971. Before that, it was an illegal act. Till today, every day, nearly 45 to 50 million MTPs are occurring throughout the world, not in India, throughout the world. So this is also a way, this is also a procedure which can control the population. So only by doing the MTPs, this is not the proper way, but during some measures, during some conditions, the females, they have to undergo for MTP. In what condition? We will discuss that. And when they amended or when they legalized this in the year of 2001, it come to an 2002 actually, it come to an amendment, it come to an act. Okay, so the next is, after the definition, after knowing all the history of the MTP, we'll see when it has to be done, and also when the amendment passed, when it come to an act, it come to an act with number of strict conditions. It has number of rules. Only MTP has to done in this condition or in this rule. Only the baby is in a first trimester. So number of rules are there. Why they took out those rules? Because in the name of MTP, number of female feticides it was doing. It is in a practice. After detecting the fetal sex, the female feticides, number of female feticides, it has been in the practice. To avoid all those female feticides, all those unlawful acts, the Indian government, it legalized the MTP with strict conditions, with strict rules. And with this, we'll move on to the next description, naming. What is that? When the MTP, when is the proper day or proper period for the MTP? When the fetus, which it is in like up to 12 weeks, up to 12 weeks, the MTP can be done. After that, what will happen? After that, the risk of MTP is more if the fetus keep on growing. Day by day it will grow, week by week it will be developing the digits and nails and organs, tissues, number of development takes place in the fetus. It is safe for the MTP. It is safe in what period? Up to 12 weeks it is safe for MTP. After that the risks are higher. Our risks are more. Alright. So, why the MTP can be done? In what reasons? For what purposes the doctors suggest for MTP? We'll see that one by one. The first reason for MTP, I am telling you, a casual intercourse without contraceptive. A casual, in that case, the doctor can suggest for MTP, casual intercourse without contraceptive. When the couple they have the intercourse without contraceptive in general way or in the casual way, they can abort or terminate the fetus. But in this period, the next reason for that is, for the MTP is failure of contraceptives. When the couple, they have taken the measures, safety measures, but after that also, if they are conceiving the fetus or conceiving the baby, in that time also we can call it as unwanted pregnancies. In that time also they can undergo for MTP, medical termination of pregnancy, or termination we can call it as, or we can call it as abortion. And during rapes, and if the fetus is congenital malformed, if the fetus is congenital and malformed, the doctors, they used to sonograph or they used to test or scan the fetus condition by number of techniques or number of tests. They used to find out if the baby is good and well and good. If it is not, they'll suggest for the MTP. So what is congenital? If the fetus is not developing properly, if it is carrying any diseases or chromosomal related or anything related, the related diseases, or the fetus is not having proper organs or digits, external features, in that condition the doctors suggest for the MTP. So these are all and also you can add here a continuous pregnancy. If one child is born in this year, in the next year also, if she is conceiving, means in that time also the doctors can suggest for the MTP only for the good health of mother and the first child. To have a gap between one child and one more child, the MTP can be suggested. So these are all the reasons for MTP. So by this name, if someone is doing the female feticides, the strict action, or it is an offense, or it is a criminal case. It will be a criminal case for those who are doing the female feticides in sense hendu bruna hatye. Okay, so with this we'll move on to the next concept. So in MTP, what you have to concentrate? You have to concentrate on the definition and reasons for MTP. Okay, so one question will be there in the examination. They'll ask what is MTP and describe the MTP, why it has been done, why the doctor suggests for MTP. So with this we'll move on to the next content, that is STD. STD in sense sexually transmitted diseases. Okay, STDs in sense sexually transmitted diseases. So the definition for that sexually transmitted diseases is, these are the diseases or infections transmitted through, these are the diseases or infections transmitted through sexual intercourse. So this collectively known as sexual intercourse, it is collectively known as STD or sexually transmitted diseases. The STD, it itself saying these are having a diseases or infections. Maybe disease, maybe it is having some infections. It will be in so many form. It will be in a minor condition, the diseases will be minor, or the diseases will be complicated that leads to death. So we'll list one by one. First you understand this, later we'll move on to the next concept. In the disease, let me tell you few more common word for the STD. It is also known as reproductive tract infection. It means RTI, reproductive tract infection, also known as, another names I am taking here. One more name is there for STD, venereal infection, VI, common name for STD, venereal infection or venereal disease. You write it as venereal disease, it is not infection, venereal disease, VD. So we'll see one by one. We'll list the sexual transmitted diseases now. The very first disease come in this sexually transmitted diseases are, it will be like gonorrhea. Alright, the second one will be genital herpes. The third is genital warts. The fourth one is syphilis. The fifth one is hepatitis B. Sixth is, I'll list out here, chlamydiasis, and the seventh one is trichomoniasis, and the eighth one is, and it is a dangerous, life-threatening HIV, human immunovirus. Okay, trichomoniasis, chlamydiasis, and gonorrhea, genital herpes, genital warts, syphilis, hepatitis B. We have number of diseases here. It gets transmitted through the sexual intercourse, during sexual intercourse. So no need of afraid if someone is having intercourse with the partner, they'll have the diseases or infections. It's not like that. If a person, if he intercourse with the infected person, then only the diseases transmits. Only that much. There is no other media for transmission. I'll tell you here, the HIV and hepatitis B. So these are the two STDs. It get transmit. Also sharing needles in sense surgical instrument. It comes under surgical instrument. I'll write one more here. When they share, who are going to share here? The person, healthy person, if he is sharing the needles or surgical instruments of infected person, the chances will be there. Surgical instrument, sharing needles, blades, surgical instruments, and also it transmits from mother, infected mother to child. Infected mother to fetus, I'll write here so that we'll come to know. So these are all the chances of transmitting of sexual diseases, sexual related diseases in this way. Other than all of the diseases, it will get transmitted only by means of sexual intercourse. And one more thing to tell here, the genital herpes, hepatitis B and HIV. Let me write all those. The genital herpes, and HIV and hepatitis B. These are, leaving these three. Let me start from there. Leaving these three, if we list out all those genital warts, gonorrhea, and then chlamydiasis, and then trichomoniasis, and what else? Syphilis. They show very less infection. Less infection, like once the persons, if they are suffering from like these type of sexually transmitted diseases, they will be having, I am writing here the symptoms of these sexually transmitted diseases. The symptoms will be a slightly pain and fluid discharge and what? Swelling and itching. These are the minor symptoms seen in these type of sexually transmitted diseases. In the early days, when the person, if he where it is occurring, these are all the symptoms occurring in genitalia, either male or female. Okay, so those genitalia, those infected person genitalia in the earlier days, mark this word, in the earlier days, if they are suffering from what is that slightly pain or fluid discharge or swelling or itching, if they consult to the doctor, qualified doctor, it can be treated. Okay, if they are not getting rid of these diseases or any of that sexually transmitted diseases, it lead to complexity. Complexity in sense, I'll write the symptoms or the complexities of sexually transmitted diseases if it is not treated in the early days. The complexities will be the first one, pelvic inflammatory disease. They will be suffering from pelvic inflammatory disease. Pelvic inflammatory disease in sense, infection in the reproductive tract of female. This is for females. Infection in female reproductive tract because of the infection of bacteria. It start infecting the external genitalia first, that is vagina. Okay, external genitalia means labia minora, labia majora, and then after infecting all those, it will transport or it transmits to the female reproductive tract. There it start infecting. That leads to a severe complexity known as complexity or complex disorder or disease known as pelvic inflammatory disease. Where it is coming, this complexity is coming under the sexually transmitted diseases if it is not cured early. What about the HIV, hepatitis B and genital herpes? All three sexually transmitted diseases, actually these kind of diseases, it cannot be cured in a simple manner. AIDS, as you know, acquired immunodeficiency syndrome it is. Hepatitis B and genital warts, these are the severe cases. Severe cases in sense, if someone is having the HIV virus, it will last for long time and it leads to death also because the immunity power will be gone. But in some cases like genital warts, if it is not cured in the early days, that leads to the severe complexities in sense pelvic inflammatory disease. This pelvic inflammatory disease occurring in the female reproductive tract because of the bacterial infection. The bacteria, it start infecting the external genital. There it travels to the female reproductive system. It infects to the fallopian tube, ovary, and then uterus. It infects everything. Okay, so that is PID. and in the severe cases it is also included. What is that? Infertility. A male or female can also suffering from they can also be suffering from infertility. Infertility means they cannot give birth to young one. Young one means they are unable to produce the male or female gametes. In the severe condition, that this is also one complexity. So that is stillbirth. Stillbirth, in this case the babies they'll be died in the womb itself. When it is happening, when a woman, if she is suffering from severe sexually transmitted diseases, having sexually that kind of diseases, if she gets pregnant, if she is having a baby, that baby will not be survived. That baby will be it will born in the died condition. So it is known as stillbirth. The next is ectopic pregnancy. Ectopic pregnancy means the fertilized egg. Where the fertilized egg will be? It will be in the fallopian tube. The fertilized egg, after taking divisions, it will sink down. When it reaches to blastocyst, it will sink down, it will transplant or implant on the uterus wall, endometrium wall. That process is known as implantation. What it will do, that uterine tissue, it will engulf or it will encircle the blastocyst. Inside the uterine tissue, the blastocyst develop. Okay, so what I am going to tell you here is about the ectopic pregnancy. So that is what I just now told you. So that is the normal procedure. But in the severe conditions, severe complexities, the implantation takes place outside the uterus. Outside the uterus means the implantation cannot take place. The fetus flows down. Okay, so that pregnancy, that condition is known as ectopic pregnancy. And the fifth one is cancer in reproductive tract. If it is untreated, if it is not treated in time, that may lead to cancer in male or female reproductive tracts. And the next is abortions. Abortions means MTP, just now we discussed about this. The sexually transmitted diseases, who are having those type of diseases, if they conceive, the fetus may not be live for a longer time. That comes out from the uterus. That results the abortions. So these are all the severe or the maximum complexities of sexually transmitted diseases if it is not treated in time. It means if one person is having AIDS, if he got treatment in time, during time, the condition, the disease will be under control, but it won't be completely, it won't go. And the next is in females. One more thing to tell here. The females are known as asymptomatic. It means the females, in females, the diseases, it won't be expressed or it won't be coming to the or expressed very fastly. like if she got transmitted from the severe disease like this kind of disease means the symptoms may not be seen. She can bear, or she's having the potency to bear that what is that the diseases. After a long time, after a short period, after the period, the diseases will be expressed. So after this, one more thing to tell here, why the STDs causes. After every intercourse, you can ask me, after every intercourse the STDs occurs. If someone is sharing the needles and the surgical instruments, everyone will get infected. So let me tell you, there are some principles, there are some rules. If we start following those rules, we'll be free from that threatened type of diseases. What are those principles? What are those rules? I'll list out all those here. The first rule we have to adopt in our life, so that is avoiding sex with unknown or multiple partner. If we adopt this rule, we'll be free from those kind of harmful, dangerous diseases. Use of contraceptives like condoms. It will be safer. It will be in a safe side. If the couple start using the contraceptive, this kind of contraceptive, they will be free from the STDs. And if someone having doubt, if one is in doubt means if in his or her genital area, if he is suffering from minor symptoms like itching, if the genital area it will become swelling and fluid is discharging from that place, if he has any kind of the doubt, once he has to diagnosed with the qualified doctor. He has to consult the qualified doctor, he has to get diagnosed, and after that he should take a treatment. If someone is, many of them, they are afraid of telling those kind of diseases. If they do like that, they will be suffering from the complexities. Complexities, as I listed everything on the board. So cancer, maybe infertility, maybe abortions. Those kind of complexities will be occur in the severe condition. If once they get treated from those kind of diseases, the disease will be cured permanently, or the disease will be under control. So these are all about the STDs and MTP. We have successfully completed today about the MTP and STD. So we'll see the next concept of infertility, and in the next session I'll give you questions assignment related to this chapter, and those questions will be related to previous question paper. So be ready. Thank you.